Welcome to the SDSU Narcan Training. This training will cover what is naloxone and Narcan, what are opioids, with an emphasis on fentanyl, how Narcan works and how to use it, how to respond to a suspected opioid overdose, and where to store Narcan. Naloxone is a medication used for known or suspected opioid overdoses in adults and children. It is intended for immediate use in emergency situations where opioids may be present. Naloxone is an effective treatment for opioid overdose and is available in three forms. 1. An injectable that requires a trained professional to administer. 2. An auto-injectable. This product is called Enzeo. It is injected into the thigh, similar to an EpiPen. Or 3. A prepackaged nasal spray. This product is called Narcan. Narcan is pre-filled, needle-free, and requires no assembly. You will be provided with instructions on how to access Narcan at the end of this training. What are opioids? Opioids are natural, synthetic, or semi-synthetic chemicals that interact with opioid receptors in the brain. Opioids reduce the intensity of pain signals and the feelings of pain. Types of opioids include prescription opioids like morphine, hydrocodone, and oxycodone, synthetic opioids such as fentanyl, and illegal drugs such as heroin. Let's take a moment to discuss fentanyl. Fentanyl can be fatal in very small doses. It's an opioid that's up to 50 times more potent than heroin. Fentanyl has been found in cocaine, heroin, meth, and counterfeit pressed pills posing as Xanax, ecstasy or Molly, oxycodone, and Adderall. People have died from fentanyl overdose who never intended to use the substance. It is important to emphasize that fentanyl can be fatal in very small doses. Oftentimes, just 2 milligrams is enough to kill most people. Take a moment to pause the video and review this graphic. Now let's spend some time talking about Narcan. Narcan can be used to reverse opioid overdose. Narcan is a small white device about 2 inches long. The device delivers an intranasal naloxone spray and is for use in the nose only. Each individual device is considered a dose, and each box contains 2 doses. How exactly does Narcan work? Remember, Narcan is a specific type of naloxone. Naloxone is an opioid antagonist used to reverse the effects of opioids. Naloxone stops opioids from binding to opioid receptors in the brain, thus stopping an overdose. The effects of naloxone last about 30 to 90 minutes. Narcan can be administered by laypeople, in this case you, or a friend, a roommate, or a family member. However, it's important to note that Narcan nasal spray is not a substitute for emergency medical care. Always call 911 if you think someone is experiencing an overdose. Narcan administration is covered under the state of California's Good Samaritan law. SDSU also has an amnesty policy and Good Samaritan policy. These policies state that students who call for help and those who need help will generally not be sanctioned for violations associated with the incident. It is also important to note that Narcan is not a controlled substance and doesn't get people high. Narcan should still be administered if the suspected overdose is due to a combination of opioids and other drugs. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders, shout their name, and ask if they are okay. Check for visible signs of an overdose. This can include them being unresponsive to touch or voice, their breathing has slowed, it may even be uneven or has stopped completely, snoring or gasping sounds, or fingernails or lips are blue or purple. Administer Narcan as quickly as possible if someone is unresponsive and an opioid overdose is suspected. Remember to call 911 as soon as possible. Notify them that you have administered Narcan, update them on the person's condition, and stay by the person's side until help arrives. Please take a moment to watch this short video on how to administer Narcan.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, hear me?
Check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Indications. Narcan naloxone hydrochloride nasal spray is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose as manifested by respiratory and/or central nervous system depression. Narcan nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. Narcan nasal spray is not a substitute for emergency medical care. Important safety information. Narcan nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping the patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance.
Now let's talk about where to store Narcan. You should store Narcan at room temperature between 59 degrees and 77 degrees. Never freeze your Narcan and keep your Narcan in the box until you're ready to use it. Always protect it from the light. Replace Narcan before the expiration date on the box, and always keep Narcan and all medications out of the reach of children. It's also important to consider where you plan on keeping your Narcan. Make sure your Narcan is in an easily accessible, unlocked location, such as a desk drawer or a medicine cabinet. Confirm that your roommates, housemates, or friends know where it is. Also consider the following facts if you plan on taking Narcan on the go. Ensure that you keep the device in the original hard plastic container until it needs to be used. It is designed so that the medication isn't accidentally discharged or wasted. We recommend transporting Narcan in a backpack or bag and not in one's pants pocket. Do not store Narcan in your car's glove compartment. Remember that Narcan needs to be stored at room temperature, and cars typically get hotter than the reported outside temperature. It is safe and legal to fly with Narcan in your carry-on luggage. So what are some possible side effects? There are actually little to no side effects associated with the actual Narcan medication. However, Narcan should not be used on people known to be allergic to naloxone hydrochloride, the active ingredient in Narcan. People may experience opioid withdrawal after Narcan is administered if they are a frequent opioid user. If you have any questions at the conclusion of this training, please follow up with our alcohol and other drugs health promotion specialist, Erin Brown. Now that you've watched this video, please complete the following assessment to confirm what you've learned throughout the training and be eligible to obtain Narcan from SDSU. After you complete the assessment, you will be provided with instructions on how to pick up Narcan.